I think like a lot of people want to tie incentives to outcomes, right? And I think like an easy one to kind of pick is like skill acquisition.
Mm-hmm.
But like it depends on the skills, right? And my concern about adding KPI, especially around skill acquisition, is do we unintentionally start weeding out more challenging cases to take on those easier ones that we know we're going to get a higher skill acquisition rate, right?
Mm-hmm.
And then again, the intention was to provide high quality services
Yep.
and but because we've lost our intention and we're only focused on the numbers, that we lose it
Yep.
in a sense. Do you know what I mean? Does that make sense?
It does, absolutely. And I think about our organization has 5 severe behavior centers where it's really focused on those kids who need 2 to 1, 3 to 1, even up to 4 to 1 because of the severity of the behaviors that they are engaging in and the risk to health and safety that is present in their lives and in their families' lives. Those children have very different skill acquisition paths. They have very different behavior reduction paths. They have extremely different needs than if you're going to an EIBI clinic where all the kids are from age 2 to 6.
Right.
And it doesn't mean one is worse, doesn't mean one is better, but the outcomes are going to be different. And you can't sacrifice serving those kids who need higher intensity support, who are going to cost more for your organization because you have to have blocking pads. You have to have safe rooms that are really built to support everyone safely. You're going to have more staff, and they're going to have to be more highly trained. You can't sacrifice serving those clients in the name of operational efficiency. You can't sacrifice supporting those families in the name of, well, we're going to get better outcomes if we serve, this population over here.
Right.
You have to find a way to map out and provide services individually within that center that also supports the organization. And I do think BlueSprig, if you ever get a chance to talk to Dr. Ashley Furman, who leads those specialty clinics, she's found a way to show those outcomes in a way that's extremely powerful. And not just like the stories are amazing. The stories of the video of seeing a child say his first word was shared with the clinical leadership team, and that was beautiful. Or, the 99% reduction in challenging behavior in a graph. That's huge, right? She has like kind of tapped and cracked the code on how to show outcomes that are really meaningful, both for the family as well as the payer for that population. But I do see organizations sacrificing serving some of those clients. Some of it is because of training. Like you shouldn't just take on that population unless you're trained to.
Right.
But we are in a helping profession, and I do think we all got into this field because we want to help. We want to use the science of behavior analysis to make quality of life differences in the lives of clients, families, and the overall field. It's important to make sure that opens a door to everyone. Even if it's not your organization, you're still supporting opening the door to everyone at other organizations too.
Yeah. Yeah, that's important. That's really, thank you for sharing that information about outcomes. I want to look more into that because, that's something that we talk about a lot, right? Mm-hmm. There was a company that we're working with, and they kind of found that the data was being manipulated because maybe the BCBA, not like anyone's doing this out of malice, mm-hmm. right? But like the BCBA were breaking down the skills into smaller components mm-hmm. to give the appearance of looking like there was more, growth and acquisition there in some of those kids who may have like just slower progress, just in general, just because mm-hmm. of who they are as a child. And it's not really what we're going for. It's not about like, how many skills can you accomplish in a certain amount of time, because I don't feel like that means quality, right?
No.
That's not, that's more like the whole like quantity versus quality, kind of thing.
Yep. No, I completely agree. I was looking at outcomes data. As we're exploring this conversation, we've been looking at what other organizations report on. And I remember seeing a graph, and it said the frequency of challenging behavior between when they started to discharge. And it was a drastic graph, it decreased. But I began to think about using the data collection as frequency rather than looking at rate over time. Because if you think of it going through a treatment path going from initiating to discharge, you should be titrating your hours. You should be slowly fading and going down in your hours. And so naturally, because of less time, a 6-hour session is going to have more frequency data points than if you're following our standards of care and doing a titration out type of plan than a 1-hour session when you're at the very end of treatment. And so I'm not saying that this organization didn't have amazing outcomes, but I found myself questioning, did you really make the impact you're saying you did? Because in my head, frequency is not the best measure to show that. Rate may have been the better measure to show that with, because of titration and discharge and the discharge plan.